Good morning and hello to my boundless friends. I am Bethany Kempfert from LC, Myofascial Release and Physical Therapy, and I'm coming to you today to talk about dural tube stretching. So if that is something you've never heard of before, you probably haven't seen me, because I typically talk about the dural tube to just about everybody who comes and sees me. So a little definition: the dural tube is the sleeve that runs around the outside of our spinal cord. And so the dural tube is actually a form of fascia, and it has a role of helping to protect and support the spinal cord and to hold the spinal cord to the level that it's supposed to be, so that each of the nerves can safely exit the spine and have space and be held in their correct position to be able to exit the spine with space. And so the dural tube, of course, is a very valuable thing to us. But what can happen is when we've had a history of injuries, say you had a lifting injury and you injured your disc, maybe that healed, but maybe everything stayed really tight and protective in that dural tube after that injury. Same thing. Maybe you had a car accident and you had whiplash injury. Everything tightened down in that fascia, in that dural tube, because fascia can do that. It tightened down to help protect. But when things have gotten through that initial stage of an acute injury, the pain should start to settle down and things should start to loosen up. And sometimes that isn't the case. Sometimes things stay tight after an injury, partly because we become so afraid of the pain that we become afraid of starting to limber up again, starting to allow our body to move, starting to allow that normal range of motion to come back. And that's a really, really important part of recovering from injury, is restoring motion. I will add a little disclaimer as we go into the exercise today. If you have an acute injury, in other words, a brand new injury to your back, to your neck, or if you're having severe pain or numbness, always keep in mind that this is a general video. It can't pertain to absolutely everybody. And if you feel like you have a pretty severe amount of pain, it would be best if you work with somebody directly to help you through that. So getting back to just talking about the dural tube a little bit, you're looking at the back of the skeleton here. So the dural tube starts all the way down here. Oh, my lighting's kind of bad. All the way down in the sacrum, the very bottom of the spine. In fact, the dural tube comes down and attaches about halfway down on that sacrum. And on the top end, it travels along with your spinal cord all the way up. And when we get to the base of the head, that dural tube that surrounds the spinal cord actually divides up, and part of it becomes the fascia that lines the inside of the skull bones, and part of it becomes part of the fascial structure that makes up the divide between the two halves of the brain. So it actually follows that all the way up and comes and attaches right by your pituitary gland. So that's why I say tightness, that dural tube, can also contribute to headaches. It can also contribute sometimes to hormone problems because of how closely it comes into that pituitary gland. So that's kind of my background on the dural tube. So we're going to go over a stretch for the dural tube, and sometimes I will jokingly call this the lazy man stretch, because other than setting up, you really don't have to work very hard to do this stretch. So I told you that I had put a message out that if anyone was going to do this with me live, they might want to have a few things set up. So the most basic tools that everyone should find would be a large towel and a small towel. I don't think anyone will not find that in their home. So what you would do with those is we're essentially going to stretch that dural tube by giving it a little bit of a lift at each end. So on the bottom end, we're going to take and lift and put a towel under your hips. On the top end, we're going to put a towel under kind of the middle part of your skull. There's kind of a knobby spot on the skull, and that's where we're going to put that. And you could just do this like I am right now with your knees just bent and on the floor. And just simply lie here and let yourself relax into this. But when I say relaxing into this, kind of like if you watched the video yesterday, I talked about that sense of telescoping. In this case, telescoping being that idea of stretching out long. In this case, you would want to think about telescoping your head in this direction and telescoping your hips kind of in this scooping direction, like your hips are going to just follow your legs and that your legs are going to telescope out in the direction your knees are pointing. So that's kind of a mental visualization, but those mental visualizations can really help your body accomplish the most out of these activities. The total stretch here, we would anticipate you'd want to stay here 3 to 5 minutes or longer. But if you're just starting this, if you're a little uncertain about how your body is going to react to it, you absolutely could start less than 3 minutes. You could start a minute and just see how your body does. You could even start with smaller lifts. I've had people start with a towel under one end only, so either the top end or the bottom end. And then when they know they can tolerate that, they add the other towel. And then as you know you tolerate it, you can add taller towels or other tools. So let me talk about some of the other tools we can use. I mentioned that if you had yoga blocks, you could bring those. My yoga blocks are all cut in half. I've made them into wedges. But if I put them back together, if you have a soft yoga block, that soft yoga block can work under your hips like this. Now, typically, by the time you get a little higher, you're going to need your legs a little bit further up. So then you might want to add a chair or a bed underneath your legs. On the other end, you might want to add a little bit more under your head. So you can use a 4-inch air-filled ball like we talked about yesterday. And again, put that kind of under that knobby spot on your head. To get a little bit more lift and a little bit more stretch that way. And again, thinking about your telescoping elongation. If you don't have the 4-inch ball, rice in a sock, beans in a sock, that can make just a nice little pillow for putting your head on as well. Okay. If you happen to have wedges, which is what I've made out of my yoga blocks, you could also do this with wedges under your hip. So lots of different options for just exactly what degree of stretch you need or want. Now for myself, and if you're pretty mobile, you might find that you need more of a stretch than that even. So a more aggressive version of this stretch is using a foam roller. So if you choose to use a foam roller, you can get that foam roller under your hips. And then in that case, your knees are going to come up here towards your chest. And then that can become your stretch. And this is the one that I routinely do before bed. And if I go 3 or 4 days without doing this before bed, those are the days I'm going to wake up feeling kind of this twangy tightness in my back that makes me not want to stay in bed any longer. And when I routinely do this, it keeps that fascia limber and I tend to wake up without any discomfort. I'm a combiner. We do want to make sure that you're able to relax and enjoy your stretch and think about the elongation. But since I'm going to be here 5 minutes and I only have so many 5 minutes in my life on most days, sometimes I will add a little piriformis stretch when I'm in this one. So you take one leg, cross it over your other knee, and you can even take and push this knee out just a little bit. And then you get your dural tube stretch, but at the same time you get this bonus of stretching this little muscle across the buttock. So that's the way I like to do it. All right, that's all I'm going to offer you today. I hope you'll enjoy trying that one out. And as always, feel free to get a hold of me if you have any questions or concerns. You can get my contact information at my website, boundlesspt.com. Again, boundlesspt.com. All right, I hope you have a great day.